just this device. It's an advanced motion sensor. It just sits in the wall. It doesn't have to be drilled in or anything. It's just command strip, so it doesn't hurt any paint. It just sits in the wall, completely wearable free, and we detect all actions that a real carer would be looking for. Anything from standing, sleeping, sitting up is how we do our fall reduction. So as soon as somebody even sits up in bed, it sends an alert and prevents that unassisted bed exit. So that could fit in with like a 15-minute check-in from CoastCare. And then of course we detect things like falls or out of bed for too long. So out of bed for too long is if you just have one device in the bedroom during the nighttime. If you fall in the living room, bathroom, anywhere like that, and you don't return to your bed in a normal amount of time that's normal to that specific person, then we trigger that alert. So it's really great for wandering, really any emergencies that can happen anywhere else. And all these alerts are customizable, and they go to a mobile app. CoastCare gets them, and that's how they do a lot of their responses. And all emergencies are phone calls as well. So you can have family members as caregivers added on, CoastCare, neighbors, whoever you really like. On top of all the detections that we do a lot of health analytics. So things that geriatricians would often ask, things like how well are you sleeping, how long are you sleeping, have you had any falls, what's your balance like? We detect all of these metrics. So here you'll see a time in bed last night, and you can track these metrics and how they change over time, weeks, months, years, however you'd like. And then we have a safety score, which is a very generalized number. Essentially, it describes how fall risk someone is based on all the movements that we detect. You can compare everything, 4 safety scores, time in bed, how many times they sit up in bed, and a really great way to track kind of the well-being of your patient is tracking the safety score and how that changes over time. And the bottom left here, there's a graph, and this is something that also CoastCare will be using to determine when a family actually needs more care coming in and more physical care support. And this is just our mobile app, very simple to use. Families can use it, care staff can use it, caregivers can use it, and you have all the analytics. We're available all over the country.
The great thing with how we connect this with our shared care program, say someone has shared care overnight and they're a fall risk, they wander, we're expected to visit them, let's say 6 different times for 30 minutes. What this notification will do is if they are awake or out of bed or have fallen to any degree outside of the norm, they would immediately be notified. They could leave the current client they're with, they're within a 5-mile radius, they'll be right there. So that's really where the partnership and the, while it does provide really good information, it's also a real-time tool of intervention.
How much does it cost?
So typically it would be a $50 actual hardware fee, and then $50 a month for the monthly subscription. Yeah, that's without utilizing our service. Correct.
That's the 100.
Yes.
Okay.
I've had a family member who wanted 4 devices, and we would do a kind of a group discount as well.
Yeah. The nice thing about it is you don't have to make a hole on the wall. So
Yes.
this could be utilized in certain assisted livings and communities. We just have to talk with their administrative staff and get an approval. Some places will not allow it, but we could still utilize our shared care.
Majority of the families that we serve are people who either use like Wi-Fi cameras at one point or have the life alert pendants. Yeah, I mean, most older adults at nighttime, they're not wearing these things, and when they do go to the bathroom, they're not putting it back on. And oftentimes, they don't like wearing them, they don't like the way it looks, so definitely a great alternative for that.
Does it talk to like an outlet?
Yeah, so just one cord that comes out and connects to the wall.
Does it need to be connected in Wi-Fi?
Yes, internet, that's it.
So if Susie was going to the bathroom, right, and Susie was there for 5 minutes, and they calibrate, and basically the algorithm picks up their routine. So if all of a sudden she was there for 6 minutes, it alerts our caregiver to make sure, hey, make sure you check the client, and they didn't fall.
Does it call the fire department?
No, so we don't contact any emergency departments ourselves. It always goes to families or the care agency.
And it's customizable in terms of who you'd like to have availability on that app.
Yeah. I'm sure you guys have cases where the neighbors are the ones taking care of them. So if they're not willing to pay for our shared care services yet because they have the neighbor, they could utilize that as well too. We will do the initial consultation and educate them on it.
Right.
Bettina?
What if they have a very large dog that they like to sleep with?
Yeah, so we actually have that scenario a lot, and it's designed specifically to ignore big dogs, cats jumping around, jumping off the bed, anything like that. So yeah, we basically thought of everything that could happen in the home. And yeah, that's a really great question.
And the beauty of these analytics, right, we've had cases where families are in denial of what their parents are actually going through. The analytics opens up and exposes what's really going on. So if they're frequently getting out of bed at night, that alerts our team. So having a care manager reviewing this is actually really good, because then they can get the family involved and have this information presented to their PCP to say, hey, you know, I'm noticing dad is getting up at night, going to the restroom all the time. I think there's gonna be a fall coming up soon. And then that way we can be collaborative and prevent that. And again, with readmissions, to lower that, connecting all of this, especially if you, again, if you have a family that's just like, I don't need 4 hours or more, dad doesn't need 24/7, this is a really great tool to get like a wake up call, like, hey, it's getting worse. Or getting better, they can taper off.
Yeah, and a lot of the time, families I'm getting involved with, I'm the primary care advocate, right? Whether they have access to the resources or whether they know what they need. Having, you know, multiple resources to encourage them, such as very specific hard data, right? Oh, you say they're sleeping well, actually they're not, right? And we need to do something about that.
Yeah, one of the most common situations that we see is families think that their loved one is not getting up out of bed very often, but then as soon as they install the device, they see that their parents are getting out of bed 5-6 times at night, and that's a huge fall risk. And that alone is something that will help families make the decision of getting care sooner than once there is a fall and it may be too late.